Welcome. Thank you, Vanessa. Welcome everyone to those that are trickling in to using social media to address tobacco use among migratory and seasonal agricultural workers. I'm super excited to share this webinar with you all today. I think social media is just key to reaching rural populations, and it also can be very fun, and you can get creative. And so our speakers today, sorry, I'm having a hard time here with the clicking, but it's myself, Missy Gallegos, Health Education Coordinator, and Julene Hickenlooper, Graphic Design and Website Coordinator. Both Julene and I are part of NCFH. We were actually just talking earlier about how long we've kind of been with NCFH and how long Julene has been doing graphic design for. So she has quite a bit of experience. She's really knowledgeable in this area. So I'm glad to have her support today. And then we have Kimberly Sanchez, Regional Coordinator with the California Health Collaborative, Changing Lives by Improving Health and Wellness. But her specific program is Latinos Coordinating Center. And so she's going to be sharing how they use social media to reach the population which they serve. So really happy to have you with us, Kimberly, and supporting us today. So thank you. And so the objectives that we're going to cover are understanding the benefits of using social media to reach, educate, and support migratory and seasonal agricultural workers, identify the best strategies and resources for utilizing social media to raise awareness of tobacco-related health risks or offer cessation resources and support to migratory, seasonal, and agricultural workers in their efforts to quit smoking or quit tobacco. And so we're also going to provide not so much quite yet the access to our social media guide to address tobacco use among MSAWs, which is going to provide templates that have tobacco related tips on how to create posts and stories or reels, and some additional resources because we're currently still designing that social media guide. But the good news is that this webinar, the foundation for it, is all based on the guide. So you'll get some great information today that is going to be shared in the guide, but you'll have a little gift a few weeks down from now that will share those templates and some additional tips to implement social media within your organization. So why is using social media key for organizations that are serving migratory and seasonal agricultural workers? Well, we know that as an organization, you can send messages anytime, anywhere, from your organization to anywhere nationwide and reach as many MSAWs as you possibly can. You can do so through the different platforms that most migratory and seasonal agriculturals use, which is YouTube, WhatsApp, Instagram, and Facebook. And so we know that it's key for those of you or organizations that do work with migratory and seasonal agricultural workers already. We know that a lot of times they work in rural and isolated communities, so that that geographical location kind of makes it hard sometimes for organizations to go out and sometimes do outreach or for agricultural workers to come to, let's say, their organization or health center. So social media can really help reach this audience. And just again, social media is key, not just addressing any health related topic, but in this case, we are relating it to tobacco, the risk of using tobacco and the benefits of quitting tobacco. And so using social media is super extremely helpful for that and just being able to get creative with using that health topic. And so what are the your sources or the resources that migratory and seasonal agricultural workers access while using these social media platforms? So when you look across the board, when it comes to Facebook, WhatsApp, Instagram, and YouTube, they're accessing community resources, health information. In this case, maybe you're putting out some tobacco related information. They're using it to communicate and stay in touch with each other. So maybe they're coming from another country to work here in the US, and it's a way to build a community for themselves. And then also they're staying connected with their family. So as an organization, knowing that this population is accessing and using these platforms for these reasons, you can use those to your advantage to share messages regarding the things that they are seeking and things that they're looking for. And just a little bit of background information. So there was a survey conducted back in 2021, and Facebook during that time was one of the platforms that MSAWs were using more extensively to capture their health information. And so again, but all the other platforms that you see here are just as important. It's just Facebook was one of the most popular during that time to access health information. Now, I do want to share a resource here, but I'm just going to pull up my notes. So this information is from the National Agricultural Survey. This was conducted by the U.S. Department of Labor, National Agricultural Worker Survey, and it was conducted among there were in-person interviews. It was 2,598 crop workers. So this is where this data came from. They wanted to know the digital access and use that they are using among this population, and 99% had access to information digitally. 92% had a cell phone that had access, that they had connection when they had access to Wi-Fi. 96% had access to texting capabilities. 40% had access to a computer, and 18% had a tablet. So when you look at the sample size, that's a pretty big sample size. So it kind of it gives us that light and that reassurance that using, digital media is probably going to be successful, because there are a lot of agricultural workers that are accessing information at high amounts if they're connected to that Wi-Fi and having that texting capability. So let's just dive into some, and maybe you guys already do these, maybe you're already using these methods to use social media platforms, but I do want to share with you all just some tips and ideas on how organizations can use social media to address tobacco use and the benefits. So really just sharing any health information, because again, when it comes to maybe the risks associated with using tobacco, quitting methods, again, because MSAWs are seeking that information. You can expand visibility on your organization, share your mission, promote tobacco cessation services. Maybe you're promoting your location, letting MSAWs know where your health center is or your organization so they can get access to that. Those community resources, they want to know where those are. So share your health fair events. Maybe you're following up via WhatsApp and doing engagement after they attend. Maybe you're creating an online support group for quitting tobacco via Facebook or WhatsApp, and there you can use WhatsApp to follow up with them after. And so again, they're wanting to seek and connect with community health workers, patient navigators to meet their social health related needs when it comes to their tobacco-free journey. And not just tobacco, but we're talking about any health related need, whether it's diabetes, maybe they need support with dental services. So you can use social media in so many different unique ways. And again, I know we're addressing migratory and seasonal agriculture workers, but all the tools that are being shared today can be used with any population. So why use Facebook and Instagram? So it provides organizations a platform for accessing stories, reels, or live streaming. Organizations can get creative with doing like a Q&A. Maybe you invite an agricultural worker to come and do a live interview, or maybe it's a recorded interview and you share the video later, and they're sharing their quit journey. Maybe a community health worker is kind of sharing the benefits of quitting tobacco use. And so there's just so many creative things that one can do to share messages through stories, reels, or live streaming for MSAW populations. And then we have WhatsApp. So I know this is becoming extremely popular among our MSAW population. It allows them, I think, really to connect with family. And also, again, looking for those health care services and that health information. And so it provides short statuses. So just like Facebook and Instagram, it has this 24-hour feature where you can provide these short statuses and then they disappear after 24 hours. So maybe you're promoting an event that you want them to come to, or a lot of times not just let's move away from tobacco, but maybe you want to share crisis communication. So maybe there's a weather alert that you want to share. There's just so many great tools and that WhatsApp offers that you can use to reach the community. And so then using channels, which is another feature, it's more of a private message that you can use during that follow up, where you can share those one-way direct messages. You can share pictures, videos, or polls as well. And so now we move on to YouTube. And so YouTube provides organizations with video sharing, making it easy for MSAWs to access those online videos. You can also not just post your own videos that you create, but you can share other organization videos. As you can see, I shared the CDC video here just as an example of resources that are out there that could be relatable to the audience that you're serving. This one per se might not be super related or connected with MSAWs, but it's just an example. But a tip for YouTube videos is trying to stick to that 3 to 5 minutes. When we've done focus group with agricultural workers, they have said 1 to 3 minutes. So no more than 3 minutes, because then you like kind of lose focus. But if you do go past 3 minutes, it's okay, because we here at NCFH we've done that too. But we've kind of taken our long videos and one example was we took it was a tick-borne prevention video and we made these smaller snippets. So we had some that were 15 minutes, 15 seconds long, 30 seconds long, and then we shared them via YouTube and also WhatsApp. So just a great other platform that can provide lots of benefits for you as an organization. And so creating and sharing effective social media messages, super important, especially for your populations that you serve. Migratory seasonal agriculture workers, what we've learned is that they really what's the word I'm looking for? They really are attracted more to community-based messaging. So although individual messaging is effective, so like, we encourage you to quit smoking because, you'll receive these following benefits, from not continuing to smoke. But if you focus on that community-based message, so the abuelita, the grandma, not smoking around your grandma, not smoking around your children, that has a much higher and effective impact. So also making sure that the social media messaging that you're working at developing is, it hits on the traditions and the beliefs of the population that you're serving, making sure that we can build that trust within the community. And so we also want to make sure that our social media messages are inspiring. So I don't know if you all have heard of Each One Teach One. If you have, feel free to put in the chat that you have, just to know, just out of curiosity to see if you've ever heard that saying. But what Each One Teach One means is really just you want to share a resource that the migratory seasonal agricultural will read, and then maybe they're having a conversation a couple of days later with someone that wants to quit smoking, and they're like, hey, I came across this great resource, and now they're teaching them about this resource and what they learned. And so really making it inspiring. And so that also that your resource or your social media resources model the health style change that you want them to make. So for example, if it's quitting smoking, you want to show some steps, you want to show pictures, you want to make it readable. So third grade reading level, if possible. Sometimes you might think that I think I've got it low enough, but no, if you think it's low enough, you got to check it again, because I promise you, you can make it even lower. I've used AI a lot of our organization. I think we kind of been learning how to use AI to help us adapt these resources and make them more reader friendly. And then when you translate it into Spanish, really you want to check your language again. because it'll get translated to higher literacy words in Spanish. So you want to make sure that the literacy in Spanish gets lowered as well. And so again, making them readable for your population. And then we want to make them realistic, relevant, and relatable. So what do I mean by this? So if they're looking at your social media post or graphic, does that picture reflect their population, their community? Does it reflect the food or the type of tobacco products that they are more likely to use? So within the migratory and seasonal agricultural worker community, through focus groups that we've done, cigarettes are the most popular and the most commonly used tobacco product. They have mentioned that vape products and cigarettes are also used, but cigarettes have been the number one more popular product. And then another example, we created some heat related prevention graphics and resources. And so we wanted to demonstrate staying hydrated, like what liquids they can drink to stay hydrated. And aside of water, we used agua frescas, which is like fruit drinks, water with fruit, and then coconut water. So really using things that they're used to, that reflect their community. And so again, making sure they're inspiring so that we can build that trust, build those connections, and encourage MSAWs to adopt those healthier choices that you want them to make, such as quitting tobacco. And so communication, when you're sharing your communication, it's super key to address those hard to understand words like addiction, nicotine, tobacco, COPD, secondhand smoke, and cardiovascular disease. So one of our tools, we did a good job. It's a patient tool at addressing addiction, what that is. It makes you want it more and more. What nicotine is, what tobacco is. It's a tobacco, it's a leaf. It's a tobacco plant and the leaf contains nicotine. And so just really kind of taking that step further and breaking down these words so that your population can understand what these words mean. So for COPD, you could say problems breathing. You can even use an example like we have in our tool. If you're working out in the field, you could have problems breathing. Explain what secondhand smoke is, cardiovascular disease. You could just simply say heart problems. But again, these are so crucial to making sure that they're simple, they're realistic, they're relatable, and that they're gonna model the actions that we want them to take. And so after you've done everything that you could to make your resources as effective as you can, if you're able to test them out with your migratory and seasonal agricultural worker community or the population that you're serving. So here at NCFH, that's one of our best practices. We do have a committee of MSAWs who does review our work. And these are just some of the questions that we've asked them. Our goal is to make sure that we're hitting every one of those sections, that they're inspiring, that they model the action that we want them to take, that the pictures make sense, that they're relatable. They have provided feedback like we want to see. For example, recently they said we want to see a migratory and seasonal agricultural worker that is working that's working in the heat, but that is wearing like a bandana or wearing a hat, showing that they're kind of that they're trying to make those steps to stay protected from the heat. And so, but this has been extremely helpful because it allows us to provide quality resources for our community that we're serving. And then, lastly, for my part, I just wanted to share the call to action. So, I was talking to Jillian earlier and we were saying, social media really without a call to action is just not going to be helpful because you want to lead them to the next step. So what resource link do you want them to visit? Do you want them to call your organization? So here at NCFH, we usually include multiple call to actions in our social media that we use. So on the right-hand side, we had done a little public service announcement, really short, 30 seconds, to address H-2A workers coming to the U.S. about the health services that are available at health centers. And so at the end, it's like, these are the services you can reach. And if you're looking to get connected to a service, to any of these services, please contact our Call for Health helpline. And then we give our number. So that's just one example how you guys can use it within your organization. But just also sharing, really again, reiterating your action, what health style change you want them to make. And so, with regards to tobacco use or any other health related topic. But with that being said, I am going to hand it off to Julene, and she's going to share some tools and tips and strategies when implementing these platforms. But thank you.
Thank you, Missy. As you know, MSAWs often work long hours. So posting at times when they are more likely to be on their phone or have access to technology is best, which is going to be early in the morning or later in the evenings. It really depends on the community that you're in and the community that you're serving and when those hours are going to occur. And then schedule your posts well in advance if you're able to. Most social media platforms anymore will have an integrated scheduling application integrated with it. Like Facebook and Instagram will let you schedule posts out, but only within their certain respective platforms. And then keeping posts frequent and especially engaging with those posts if you get comments or shares is going to drive your engagement and is going to drive people to your platforms. Next slide, please. Another way to keep organized with your different social media channels is paid social media management tools such as Hootsuite or Buffer. You can keep track of multiple postings across multiple channels. And there are many different social media management tools. Those are just two examples. And it's really important to do some research. What is your organization's need? What is your budget? What's going to work for you and your organization in reaching the community that you serve? Next slide, please. The good part about social media is that you don't need a paid social media management tool to accomplish those engagement goals and reach that you have. Using a basic calendar, you can use Excel, Google Sheets. NCFH has developed a social media tracker to help keep organized with different platforms that you could be using and when you're posting and which platform you're posting on. Next slide, please. There are a number of tools to help you strengthen your social media visibility and efforts. We've provided just a few examples here. Canva, Adobe Express have easy to use templates to create social media posts. You can do videos. They've got very specific sizes to each platform that you could be using. They also have stock images available on those platforms. There is kind of a paywall with some of the quality of these resources. So again, that's going to be what your organization's goals are and what your budget is if you want to look into a paid option, but they do also have free options as well. Same for stock image sites. We list Shutterstock, iStock, and Vado as examples. There are many others. These sites do have royalty-free images. They also have free-to-use images. You just kind of have to dig through them. The better quality are usually behind a paywall, which again is organizational independent, and if that meets your budgetary needs. There are free sites. Pixabay and Pexels are two examples where they have free to use assets. And then with any stock image site, please do make sure that the ones you are acquiring have a free for commercial use license. Or if they have any attribution requirements, sometimes they will require you to say picture by or illustration from. But even better than stock images, if you have internal images or community images, and you have permission as an organization to use those, your posts generally will track better because they will feel more authentic to your organization and your community that you're serving. So where you can, try to use internal images. Bitly and tinyurl are examples of URL shorteners. This is most common for platforms that have a small character allowance. So X, Threads, and Blue Sky have very limited character allowances for your posts, and having a shortened URL can save you some words. Um, Also, Grammarly can help ensure that your social media content is clear and it's free from grammatical errors. They do have a free version and a paid version. So, again, based on your organization's needs and budget. Next slide. Another thing about social media channels that maybe doesn't get said out loud often enough is promote your other social media channels. Cross promotion is often a great way to make sure that you've got your organization's net across all social media platforms. Sometimes people on Instagram don't realize you have a Facebook or that you have a WhatsApp number. So make sure that you do cross promote those channels when applicable. Next slide. Um, it kind of goes without saying, but please make your social media pages and posts public. You want to be findable to these communities. You want your information to be findable and trackable. Another good way to increase engagement is to follow other trusted organizations and partners and invite them to follow your organization back. You can tag them in relevant messaging that you have in social media posts. We like to do that with our partner organizations. Anytime that we're working in a partnership, we want to make sure that we cross promote with their channels as well. Most social media management tools will allow you to tag within their app, and it's usually an @ Um, and then, of course, in any printed material, please post all of your social media handles and channels. We want everyone to be findable, and of course, have your social media icons on your website. With that, I will hand it off to Kimberly.
Thank you so much, Julianne, and hello, everybody. I'm so excited to speak to you all today on Connecting Through Content, where we will discuss social media strategies for tobacco prevention. So, today we're going to explore how my organization, the Latino Coordinating Center, has used social media effectively in our efforts to engage audiences in tobacco prevention and education. So, social media is not just a platform. It's a powerful tool that can help us reach and resonate with our communities. So, as we dive in, I want you to think about how you can leverage these strategies to make real impact in your communities. And next, we'll discuss the important role of the Latino Coordinating Center for a Tobacco Free California and our mission, and how it's tied back into our social media content. So, to begin, the Latino Coordinating Center for a Tobacco-Free California, or LCC, is a project operated by the California Health Collaborative in partnership with the University of Southern California. And together, we are committed to addressing tobacco-related differences that impact populations in California. More specifically, our focus is on Spanish-speaking Californians who make up a large population of our state. So this focus gives us a direct guidance on who our audience is to create material that resonates with them to really get our message across. So we focus on reducing these differences through the adoption and implementation of key policy and system changes. And this isn't just about reducing smoking rates, it's about creating healthier communities and sharing resources and providing that support. So now let's delve into our social media objectives. First, we aim to launch and participate in tailored and relevant campaign initiatives. This means creating campaigns that resonate with our specific audience and their experiences, and ensuring that these campaigns are relatable to them. Second, we want to share resources tailored for our Spanish speaking audiences. It's crucial that the information we provide is both easy to understand and actionable for those who come across our messages. And we do this by sharing announcements of recently released resources, such as our educational materials, which are always something that we're working on behind the scenes, or announcing our annual recruitment for our public health internship program for college students, which has actually allowed us to gain traction and gain a larger following among the young adult age group on our platforms. And lastly, we seek to increase our reach by expanding our efforts to a wider audience. We do this by engaging more individuals and communities, and that helps amplify our impact as well. So, oftentimes, we'll collaborate with partner organizations on a specific post where we combine our own knowledge based on our areas of focus and create informational material to expand our information into other sectors or even into other audiences. And other times we reshare posts created by partners, which allows us to our audience and receive educational information from their skills and expertise. And overall, these objectives guide our strategies, ensuring that we effectively communicate our mission and connect meaningfully with the communities that we serve. So, we utilize various social media platforms to not only get as much reach as possible, but because each platform offers something different and different benefits. So, for example, Instagram has allowed us to provide visual storytelling and updates. And this approach not only captures attention, but also conveys our message in a relatable way. And Facebook has been shown to be a platform where local community updates and events gains the most traction for us. These posts keep our audiences informed and engaged with our initiatives. And the platform X, otherwise known as Twitter, allows us to provide real time news and conversations, whereas YouTube is a service that we mainly use to upload our recorded webinars or presentations for partners and stakeholders to reference in the future. Most recently, we've created a Threads account and have been exploring how this platform can be used to drive a higher engagement, but overall, using multiple platforms helps us reduce the risks associated with a single platform's algorithm or audience shift. So it's all about reaching our communities in the spaces they already occupy. And one of the most successful platforms for us has been Instagram. So, first, Instagram offers higher engagement rates from youth, young adults, and our partners. This demographic is crucial as they are often the most active users and can drive our message further. This doesn't mean that other platforms aren't great, but for our metrics via Hootsuite, as you can see on the slide, we can see our Instagram has been the platform that has reached a higher engagement. Secondly, it's a visually driven platform that aligns perfectly with the type of content we produce. So our stories, images, and videos can really shine here, making it easier for our audience to connect with our message. And lastly, Instagram also allows us for easy resharing and partner amplification. So this means when our partners engage with our content, it can quickly reach a wider audience, amplifying our efforts without additional resources. And these reasons combined make Instagram not just a choice, but a very strategic advantage for our initiative specifically. So we have three main content types that we focus on. The first one would be announcements. These are crucial for keeping our audiences informed about important updates and events. So this usually involves announcing recently released educational materials or the recruitment of our internship program being open for applications, or local events such as community forums and town halls that we've been a part of. This helps maintain our transparency and our engagement with our audiences. And second, our educational posts. They allow us to provide our intended audience with safe and reliable information. However, we relay information in a way that will appear relevant to them. So we don't just want to throw something at them that they might not find relatable. And so, based on the seasons or digital trends or even emerging public health issues, we'll tie our educational pieces into something that will really resonate. And so, displayed here is an example of how we wanted to target pet owners and animal lovers to educate them on secondhand smoke by showing how this affects the animals in their life. And additionally, this was actually posted in December during the holiday season, which was relevant to many of us as we were looking forward to celebrating during that month. Third is our partner highlights. We love highlighting the amazing work our collaborators are doing. It helps strengthen our partnerships and share valuable knowledge with our community, but it also helps us spark new connections with other organizations along the way. So, by offering a mix of these posts, we cater to different interests and needs, and it helps us ensure that our audiences are always finding value in what we share. So, it's essential to remember that each type of post that does serve a purpose in enhancing our overall message and engagement, ensuring that our posts are very intentional. So, as we dive into our content pillars, let's emphasize the importance of credible content. First, we need to cite facts and figures that support our messages. This not only builds trust, but also positions us as leaders in our field to be up to date on the latest information. Behind the scenes, we have a working document that allows us to list every post we upload with the citation of where that information was pulled from. Next, we focus on being informative and tailored. So it's crucial that we present our information in a way that's easy for the audience to understand. For us, this means translating our English posts into Spanish and using language and phrases and words that resonate and is actually being used by our audience. And let's not forget the power of a call to action. So, by offering clear steps viewers can take, we engage them further and encourage participation. So, we recommend calls to action that are realistic and attainable, similar to a SMART goal. And this usually always ties back into the main message of the post. So our interns actually play a crucial role in content creation. Here you can see a post designed and developed by one of our interns in our last cohort who tied in the intersection of diabetes with tobacco to create an informative post. And so involving interns is one way we open our efforts to not just new content, but new ideas. And so, first, it's important to consider how interns bring new and creative input. They're often in tune with emerging trends and platforms that we may not be utilizing yet. So, this fresh perspective can significantly enhance our content strategy and allows for the opportunity of bringing fresh ideas to the table. And interns have a unique advantage that they understand what resonates with their peers. So their firsthand insights can guide us in kind of crafting content that truly connects with younger target demographics. And finally, we have analytics and reporting skills. So, by managing social media in a professional context, interns learn about strategy, branding, and important tools for analytics and scheduling. So, this not only benefits them, but also strengthens our overall approach to content management. And this also allows them to learn of the social media strategies behind digital media that they may not experience when using these apps on their own for their personal use. And so not only are they able to see the importance of social media metrics and analytics, but learn the power of utilizing social media calendars that allow us to take advantage of algorithms. So engaging interns is not just beneficial for them, but it's also vital for us to stay relevant and effective in our messaging. And so launching campaigns together with partners is another way we maintain connections and participate in digital movements. When all partners actually post at the same time, the message becomes stronger and creates a bigger buzz that resonates more effectively than scattered individual posts. So, our most common form of campaign launch occurs every year when our tobacco prevention partners visit the Capitol in Sacramento for 2 days to educate elected officials on our efforts and raising concerns. So, During this event, we've seen high engagement when we come together and use the same hashtags and post together at the right time. But this means that we need to focus on planning launch dates. So by coordinating visuals, tone, timing, we ensure consistency. And this makes the campaign feel very cohesive and part of a larger narrative rather than a collection of random posts. So always adapt content is crucial more than ever during these situations. Tailoring messages ensures that audiences do feel that the content speaks directly to them and it was made for them rather than receiving a generic message. So we tie in campaign messages back to our target audience to make sure it's still relevant to them and that these posts can truly connect with them. So the personalization is always key to engagement. And as we wrap up, let's focus on some key takeaways that we covered today. So, first, it's important to remember to use platforms with a purpose. Although social media can be fun, it's always important to be intentional with the content that you release. Tailoring your content to fit your goals is essential for effective communication. And this means not just posting the same content everywhere, but adjusting your message to resonate directly within each space or platform. Each social media platform has its unique audience and strengths. As mentioned before, Instagram has been incredibly successful for us, but maybe Facebook will be more beneficial for your team. So it's crucial to track what works and keep an eye out on your metrics, what content is performing well, what isn't, and be prepared to test new ideas and pivot when necessary. Flexibility is key now more than ever in this evolving digital landscape. So it's important to remember who your audience is and create for them. And the better you understand your audience's preferences and values, the more impactful your engagement will be. And this tailored approach will foster deep connections and enhance your overall impact. So, as we wrap up today's presentation, I wanted to take a moment to invite you all to connect with us on social media. We'd love to keep the conversation going and share more exciting updates with you. So you can go ahead and scan the QR code. The link will also be shared in the chat box. And thank you all for your time today. It's been a pleasure. And I'll give the floor back to Missy.
Thank you, Kimberly. So I think I figured out how to put my notes or my screen in front of my, like directly in front of me, because earlier I was looking at the other screen, so I apologize. So like Kimberly and Jolene, I'm not the most tech savvy. My my degree is in public health, and so I feel like I learned a lot from Kimberly and from Jolene just throughout the webinar itself. So thank you, Kimberly. Thank you, Jolene. I think Kimberly shared a lot of great, just information in regards to the internship. I love that idea. So really, like you said, they're a lot younger coming in, if you're older like myself and you're not super tech savvy, then having an intern might be a great creative way to kind of get your ideas going as well. And then I love how you talked about the partnerships. So maybe during the Q&A, we can dive more into how everyone here who's present, how you guys are using partnerships or sharing each other's resources to kind of really expand your organization's vision and mission. But with that being said, I'm just going to dive into a couple of resources we have coming up. If you were present for the last webinar, tobacco webinar that we held, it was focused on building community partnerships to address tobacco use. And you may have already heard about most of these resources, but I mentioned earlier during the last objective that we are working on a guide that Julene is designing for us. So it's gonna have pretty much most of what we discussed today, including some really neat templates. It's going to discuss the benefits of using social media to reach MSAWs, which we pretty much did today. But the guide is broken down by 8 social media strategies. And then each strategy is going to have tips and tools, and they're going to be specific to the most commonly used platforms among MSAWs. And then, like Kimberly said, for them, I believe it was Instagram, correct, that was the most effective. But, Facebook, as that survey I mentioned in 2021 was most effective at that time. So it really just depends on the trends and what's currently happening as far as what's going to be the most effective for you as an organization, as far as what platform to use. And then, so sample social media posts for Facebook and Instagram. And then pretty much you can use these same sample social media posts for WhatsApp. And so we look forward to sharing this guide as soon as it's ready. It is currently in design. Julie does a great job at designing our HRSA tools for organizations and for for patients. So I'm really looking forward to seeing how that turns out and sharing that with you all. But I should go back a slide. But a second resource that we're currently updating is titled A Guide for Health Centers to Address Tobacco Use Among MSAWs. This guide does define tobacco products, the different types of tobacco products for organizations to understand a bit more of those, the benefits of quitting tobacco use specifically for MSAWs. It shares why MSAWs are vulnerable to tobacco use, and then screening tools and strategies to address tobacco use. So you're probably already using, if you work in a health center, maybe you're already using UDS screening tools or something specific that is tailored within your electronic medical record. But this just provides some additional tools that you can use that are evidence-based and are going to work and provide an effective, just additional approach to addressing tobacco use. And sometimes when you go out in the field, you don't have a lot of time. And so there's a 5 A's intervention, which is AAR, ask, advice, and then refer. So it just provides a quicker way to capture that opportunity to refer them, your individual you're talking to, or the population that you're serving, to a quit line or a tobacco program. And so in this guide, it also addresses the benefits of quitting tobacco use for MSAWs and how it relates to them specifically. So saving money, less days of feeling sick, and possibly less days of missing work. We know for those of you who work with MSAWs that a lot of times just having days off or PTO is not it's not part of their professional, their profession, as far as being able to just have that luxury to ask. So staying healthy and staying strong is so important to them. And, knowing that they'll have less risk for cancer, stroke, heart, and breathing problems. Again, as you can see in that third bullet point, that was our way of kind of just breaking down COPD by just sharing breathing problems or just, heart problems. Less coughing and healthier lungs, less shortness of breath when doing daily activities, specifically when working in the field. When we had previously done focus groups with agricultural workers, they mentioned that they know the reasons why they should quit, but they felt that the benefits of continuing to use tobacco just helped them get through their day. And so it's just kind of nudging them and motivating them and constantly just letting them know that you're there, that you're going to support them. And if it's doing so through that social media messages or sharing resources like this, it's going to really kind of help increase their wanting to want to make that change to quit using tobacco. And so we took that guide for organizations and then we broke it down and we created a patient tool. And so this patient tool defines what tobacco is. This is kind of where I mentioned that we break down what tobacco is and we define it. We define nicotine. And so we define what secondhand smoke is. And so it's just a really great tool. It's actually a door hanger. So if you're doing outreach, you can just cut out that little dotted line and go hang it up on someone's doorknob, sorry, and just drop it off if that's all you're able to do. And so this resource was created by, the content was created by one of my coworkers, Megan. She did such a great job with this. Julene designed it. I think it's just great in the sense that it mirrors the stages of change to helping make healthier choices when it comes to tobacco use, wanting to quit tobacco. If someone's in that pre-contemplative state, how do you get them to contemplation? And the cool thing is that this resource is specifically for you to hand out to an MSAW. And so it explains it's a scenario throughout pre-contemplation all the way up to maintenance. And it starts with introducing an MSAW whose name is Juan. He's 45 years old. He picks strawberries on the farm and he's been using tobacco since he's 16, smokes a pack of cigarettes a day. The smoking helps him feel less stressed when working long hours and less lonely because he's away from his family. But Juan meets Carmen, and Carmen is his CHW. And so Carmen is working with Juan throughout these stages of change. And so I think it's not only beneficial for the MSAW, but also for you all as an organization or an individual doing outreach, because you're able to kind of get an idea of like, how can I have these types of conversations with the patient that I'm serving? And Vanessa also added an additional link. So this actually has a guide that's specifically designed for organizations. So it's a two-part tool as well. So it's got the guide and then it's got the patient tool. And then those links have been provided and those are already available for you to use and start sharing as well. And so, but with that being said, that wraps up just the main content of our webinar today. Again, my name is Missy Gallegos. We had Julene Hickenlooper and then followed by Kimberly Sanchez. And so you have our emails here in case you have any direct questions for Julene regarding any of the tools that she shared. And then Kimberly Sanchez shared her QR code on, following them, or you can email her in reference to any of the things that she represented today. But with that being said, just thank you so much. Again, this does conclude this portion of the webinar. We are going to go on to the next step, but at this time, we are going to end our recording for the live webinar.